Eastern Cape, where more than 100 pupils had to be rushed to the hospital after falling violently ill yesterday. Officials say some of them from the Kobozizwe Agricultural School near Mthatha are in a serious condition. It's the latest in a string of school-related food safety scares in the Eastern Cape and other parts of the country. Provincial Health spokesperson Sianda Manana joins us now live from Gqeberha with more details on this. Sianda, thank you so much for joining us this early in the morning as well to share on this important and significant story. Would you please just give us an update with the exact number of the pupils and their health right now?
Thank you very much. The number that we have at our disposal, it's 131 that we're seeing in our health institutions. They being Nelson Mandela Academic Hospital, the other one being Mthatha Regional Hospital, and Ngangelizwa Community Health Center. So all three health institutions attended to the 131. Currently, we have one admission at Nelson Mandela Academic Hospital. The other two at Mthatha Regional. They are actually being monitored and they were rehydrated. There were others that joined, from their homes. They went straight to the hospitals to be attended. We ferried most of these kids using our our PTVs, which is patient transport vehicles, EMS vehicles, as well as the ambulances and our chopper to ensure, that we don't have any fatalities. So at this point in time, we had an integrated team from different spheres of government. The local one, which is your OR Tambo disaster, your OR Tambo environmental health practitioners. We had South African Police Services. We also had our own EMS personnel to make sure that we don't have any fatalities and that we respond swiftly and quickly to any eventuality in this kind of disaster. Yeah. So we were able to maintain. So that's the current status.
Sure.
Otherwise, most of them, which is 128, they were sent home, so they are fine.
All right. Are you able to detail for us the suspected food poisoning then as well, and just where it would have come from? Was it from the school itself, somebody selling to the school, or where would these items have possibly come from? Are you aware of any of that at all?
Well, what we got from, from the school was, as well as the kids, was that, they consumed rice and tin fish, at the school, and then they immediately exhibited now the symptoms of nausea, dizziness, abdominal pains, vomiting, and others had seizures. So that is those are the symptoms that that were exhibited by the kids.
All right. So to confirm, then 128 of the pupils, you say, of the total of 131 are safely back at home, or in hospital, but are safe and don't exhibit serious conditions.
All of the 128, they are home. The two, they are being monitored. They were being monitored as from last night, and then one was admitted at Nelson Mandela Academic. But that one is also out of danger, so he is also fine. So all of them, we can, safely say they are, out of danger. There's absolutely nothing. Our clinicians, they attended to them quickly, and they are fine.
Yeah, with regards to the Kobizizwe Agricultural School then as well, any word from them with regards to what it is that they will be doing to ensure this doesn't happen again, the kind of accountability that perhaps they're taking here?
Well, I have not spoken to the school. It's not my area. However, I mean, any normal and responsible, as a responsible government, obviously the officials there, they would have ensured that they don't proceed with the feeding of the kids. Remember, we've got environmental health practitioners there. It's their job from the municipality to ensure that when they go to the school, they take samples and they seize the feeding of the kids so that, you know, they have, you know, combed the area quite nicely for any leads that can point to the causal factors.
Yeah. So is that safe to say that there is an open investigation into understanding, yes, the cause, which you've now ascertained a little bit there as well, but also just whether there should be any repercussions here at all?
Exactly. That's what is going to happen. And in any instance of this nature, that's what we normally do. We go in there as an integrated team from the different spheres of government to ensure, you know, that we uncover what was the causal factors, and then we prevent future occurrences.
Eastern Cape Department of Health spokesperson Sianda Manana, thank you so much for the time.